Health, prevention. First medicine revolution. The approach to animal health has fundamentally shifted over 7 years from reactive treatment to proactive prevention. The industry has embraced the philosophy that maintenance is cheaper than breakages, transforming both animal welfare and farm economics. This philosophy was the central theme of the 2024 SA Cow Longevity Conference, emphasizing the value of proactive care and continuous investment in herd health. Prevention is consistently more economical than treatment, creating a compelling business case for welfare-focused management. Sustained investment in animal welfare creates lasting benefits with direct connections between comfort and production performance. The industry has learned that animal welfare and profitability are not competing goals, but mutually reinforcing objectives. Cow comfort has become foundational to health management systems. Optimal cow comfort directly influences health, productivity, reproductive performance, rumen function, and longevity. This comprehensive understanding has led to systematic approaches to comfort optimization. Adequate space for natural behaviors is essential for psychological and physical well-being. Clean bedding reduces disease risk while supporting natural resting behaviors. Proper ventilation systems support respiratory health and temperature regulation. Easy access to food and water ensures optimal nutrition without stress or competition. Stress reduction through automated milking systems and clean handling procedures improves both welfare and productivity. The understanding that stress directly impacts immune function and production has led to comprehensive stress management programs. The IBF World Conference in Paris revealed an important evolution in thinking. Animal welfare is gaining significant ground, with focus shifting from merely the absence of suffering to ensuring positive experiences for animals. This represents a fundamental change in how the industry defines and measures welfare. Research demonstrates that farm livestock welfare often influences animal welfare in the farm. Self manufacturing may significantly improve farm welfare outcomes, highlighting the interconnected nature of human and animal well-being in daily operations. Advanced disease prevention has become sophisticated and systematic. Vaccination programs are considered one of the most effective ways to shield herds from infectious diseases. They are introducing antigens to broadly boost immune defense through controlled exposure to pathogens. Tailored vaccination programs, developed with veterinarians, ensure timely and cost-effective immunization, limiting losses from preventable diseases. It's important to complex vaccinations. Compulsory, demonstrating the regulatory framework supporting disease prevention. Biosecurity measures have become comprehensive and integrated. Stringent biosecurity, including preventative vaccination, tick control, and helminth control, are crucial for maintaining herd health. Regular surveillance helps in early disease detection, preventing serious health crises. Effective biosecurity protocols and employee training significantly impact herd health and profitability. Training on disease transmission, recognition, prevention during milking, treatment techniques, and milking machine disinfection creates multiple layers of protection. The 30-day quarantine protocol for new animals has become standard practice. Safely buying cows involves quarantine and disease testing before introduction to the main herd, protecting existing animals from external disease threats. Mastitis remains the most serious disease afflicting dairy cattle, with substantial economic impact. The costs include labor and treatment expenses, discarded milk, reduced milk production, and potential loss of quality premiums. Chronic mastitis, particularly from Staphylococcus aureus, accounts for a large share of costs due to bacterial spread. Detection methods have improved significantly over 7 years. Foremilking and stripping remain the best methods for early detection of clinical mastitis. Combining electrical conductivity and the California mastitis test is 3 to 4 times more accurate for subclinical mastitis detection than either method alone. Treatment approaches have evolved toward more targeted and reduced antimicrobial use. A significant study found local penicillin treatment for mild to moderate clinical mastitis to be non-inferior to combined local and systemic treatment, suggesting a potential 16-fold reduction in antimicrobial use without adverse effects on cure rate. Hygienic intramammary treatment protocols are critical, requiring proper preparation, clean gloves, teat dipping, and cleaning of teat openings. These procedures reduce treatment failures and prevent secondary infections. Teat dip selection has become more scientific, with choices depending on specific mastitis-causing organisms and skin conditioning needs. Chlorine dioxide-based teat dips are highlighted as economical and effective options for many situations. Heat stress management has become critical, especially for Holstein cattle. Heat stress significantly impacts welfare, growth, production, and mortality. It represents a major challenge that affects both animal well-being and farm economics. Mitigation strategies combine multiple approaches. Nutritional adjustments include highly digestible feed, dietary fat supplementation, electrolytes especially potassium, and specific feed additives. Management practices include clean and cool water provision, ventilation systems, and sprinklers for cooling. Genetic selection for heat tolerance is increasingly important, as climate change intensifies heat stress challenges. Breeding programs now incorporate heat tolerance traits alongside traditional production and conformation characteristics. Antimicrobial resistance represents a top global public health threat that affects dairy farming practices. The WHO targets a 20% reduction in antibiotic use by 2030, creating pressure for alternative approaches to disease management. Waste milk containing antibiotic residues fed to calves raises concerns about fostering antibiotic-resistant bacteria in calf gut microbiota. This practice requires careful consideration of alternatives and risk mitigation strategies. Responsible antimicrobial use requires accurate diagnosis, proper treatment protocols, staff education, and comprehensive record keeping. The industry is moving toward more targeted and shorter duration treatments when antibiotics are necessary. Research into natural alternatives shows promise for reducing antimicrobial dependence. Essential oils are being explored for preventing infections, treating parasites, and enhancing production and rumen function. Some show promise for increasing milk yield and preventing milk fever. Disease-specific management has become more sophisticated. Brucellosis, as a global zoonotic infection causing abortions and retained placenta in cows, poses risks to humans and threatens food security. Eradication requires test and slaughter, combined with prevention and controlled animal movements. BVD, bovine viral diarrhea, has significant circulation in South African herds, impacting milk production, reproductive efficiency, and overall herd health. Control involves vaccination, biosecurity, management practices, and continuous monitoring to achieve herd immunity. Anaplasmosis, transmitted by ticks, blood-sucking flies, and needles, requires prevention through frequent dipping, vaccination, and blocking methods. Understanding that blue ticks are one-host ticks laying up to 2,500 eggs helps in planning control strategies. Avian flu in dairy cows was confirmed in March 2024, with symptoms including lethargy, reduced milk supply, and changes in milk appearance. The likely spread from birds to cattle and then among cattle via physical objects demonstrates the importance of biosecurity. Specialized health products have emerged to address specific challenges. Mycotoxin management represents a significant global risk, with Vitam International's MMI.S technology serving as a broad-spectrum mycotoxin binder, highly effective against DON, FUM, and ZEA. This technology improves feed efficiency, immunity, productivity, fertility, and sustainability, while providing economic protection, preventing production losses from contaminated feed. Calf health receives focused attention as key to future productivity. ElectroCalf provides oral rehydration formula for scouring calves. Winter calf rearing strategies focus on feeding management, hygiene, and disease prevention to combat cold stress and weight loss. Advanced detection methods are being investigated. Echotextural and ultrasonic detection methods are being researched for identifying subclinical and clinical mastitis. Technology integration uses advanced diagnostic tools for early intervention. Precision health approaches provide tailored treatments based on precise diagnosis. Continuous innovation through ongoing research improves health management capabilities and outcomes. Gut health optimization addresses the connection between digestive health and overall performance. Leaky gut prevention addresses acidosis-induced intestinal permeability. Endotoxin absorption prevention stops LPS absorption that causes inflammatory responses. Feed efficiency is directly impacted by gut health, making digestive health management essential for production optimization. Nutritional approaches use targeted nutrition to support intestinal integrity and beneficial microbial populations. The Dairy Standard Agency performs tests to promote dairy product safety, including microorganism, chemical, and metrological tests. This systematic approach to safety supports both animal and human health. Research continues into alternative approaches. Aloe vera as a semen extender supplement is being explored as an alternative to animal-based products due to disease transmission concerns. Studies evaluate the effect of Allium sativum, garlic, on neonatal dairy heifer calves with cryptosporidiosis. The need for continual learning and updating knowledge is highlighted given advancements in medicine and health. Veterinary medicine continues to evolve rapidly, requiring ongoing education and adaptation of practices. Key insight: modern dairy health management requires systematic integration of comfort optimization, disease prevention, early detection, responsible treatment, and continuous monitoring. Success depends on understanding that animal health, productivity, and profitability are interconnected elements requiring proactive rather than reactive approaches. The most effective programs combine traditional animal husbandry wisdom with advanced technology and scientific understanding. The 7-year evolution from 2018 to 2024 has demonstrated that prevention-focused health management consistently delivers superior animal welfare and economic outcomes compared to treatment-based approaches.